Mm-mm. Hi, I'm Anna Johnson. This is my third video on malaria, how to treat it. Take an anti-malarial. Don't take quinine, it doesn't work anymore, but artemether lumefantrine works and it works very well. Lots of great news about this drug. In West Africa, it is very available. It's at every pharmacy. It costs about $2 for a whole round of treatment. The side effects are pretty low. The contraindications are more cautions. Um, That's, that kind of philosophy. If you like that kind of philosophy, the drug interactions, it might change some of the levels of the drugs, but there's nothing really terribly strong. And it's a great, readily available, life-saving medication. It works during the erythrocyte stage of uncomplicated malaria. So if you treat your malaria very early with this drug, it will squash it. The hardest thing about this drug is keeping it down because your patient probably has profuse vomiting and they need to take this with something fatty like chocolate or oil. And that could be kind of hard to do if you're very nauseated. So the little girl, HH, used this and it worked, killed off her malaria. It was just a memory. Artesunate is what your patient will take if they didn't catch their malaria early on and it developed into severe malaria. So the artemether lumefantrine works with low levels. This is very high levels of malaria. Your patient at this point has severe anemia, their brain's affected, their organs are affected, and all their blood vessels are affected. So because this malaria can kill you very easily, you're going to take you're going to give this medication no matter what heart issues or kidney issues, no matter what's going on with your patient, this will hopefully save their lives. The only contraindication is anaphylaxis because that'll kill you faster than malaria. Also works during the blood phase of the disease. And this delayed hemolysis is less common, but it's something you have to watch out for because these patients already have terrible anemia, and this can keep killing off the red blood cells for the next month. So you want to keep your patient in the hospital and be monitoring that. Sadly, these ones in bold are common side effects. So DD had severe malaria because he treated it, but he didn't treat it early enough. So he thought he was fine taking the treatment, but the artemether lumefantrine didn't get it. He was like this 20-year-old guy, strong guy in this remote Ivorian village, and his friends found him lying on the floor of his hut and had to tie him to a motorcycle because that was the only mode of transportation they had, and he was too weak to sit up. So they bring him to the hospital, and he's doing terribly, and his organs are starting to shut down, and he ends up being in the hospital for a little over a month where he is treated for malaria and gradually regains his strength and lived happily ever after. Primaquine is different from the other medications in that this works for two forms of malaria. It works for PO Valley and PVVAX. So these are less common forms. They are not forms that will kill you. They won't develop into severe malaria. That's P. falciparum. But these are the ones that can hibernate in your liver and just pop up whenever your immune system is weak. So you could just get malaria like someone gets the common cold, and it won't kill you, but it's really unpleasant, especially if you're in a country where malaria medication and malaria diagnostics are not very available. So it works in two different stages against these two strains of malaria, in the liver stage and in the blood stage, and it has some more side effects and more contraindications because this isn't a matter of life and death. So you won't give it to your patient under every circumstance, like if they're pregnant or nursing. Great thing about this medication is you can use it as a low dose for like prevention, and then you can use it at a higher dose for treatment, and then you can use it at a really high dose, and that will just totally eradicate all the PO Valley or PVVAX from your liver. So you don't have to deal with getting it, every time your immune system's weak for the rest of your life. It's pretty cool. So, oopsie. SJ was getting malaria a couple times a year, even though he hadn't been to Africa for years. And he would have to source these medications from around the world with friends bringing it back for him. And he finally ended up treating with Primaquine, and now he hasn't had malaria for like 10 years. So, two questions. Why is it worse to have malaria in the USA? And what do you think SJ probably had if he kept getting malaria for years? What strains do you think he might have had? Here are my references. Thank you for